Hello, and thank you for coming to my final presentation. My topic for my essay was complementary and alternative medicine, also known as CAM, specifically in regards to cancer. According to a study by Marcus Horneber et al., 40% of surveyed patients across 18 countries used complementary and alternative medicine to treat their cancer. Now, granted, the study was from 2011, but the study did say that this statistic has increased over the past few years, so I think we can safely say that it has continued to increase. However, there are also studies that prove that complementary and alternative medicine is not effective in treating cancer. In many cases, it can be harmful. A fact sheet by Dr. Andrea S. Blevins-Primo cites a study by Schuyler B. Johnson that showed that cancer patients who used complementary and alternative medicine had a shorter 5-year survival rate versus those who just used conventional medicine. So my research question centered on the reasons, specifically the psychological reasons, why alternative medicine is attractive to cancer patients despite its proven ineffectiveness. And through my research and analysis, I found that these promoters of alternative medicine recognize the common psychological states of cancer patients, such as mistrust in the medical system or desire for control, and use them to promote their products. The main site I researched for my paper was the Foundation for Alternative and Integrative Medicine, FAIM.org. I'm going to be referring to it as FAME for the remainder of my presentation, but the homepage of their website states, quote, "FAME's mission is to create a revolution in worldwide healthcare." This was the main site I used for my research because they have a lot of articles about alternative medicine and cancer. What initially drew me to their site, however, was a near 2-hour documentary called Cancer is Curable Now. And when I saw the title of this, I realized that I just had to watch it. And Cancer is Curable Now features testimonies from all kinds of people, authors, nutrition consultants, and chefs. Notably, not that many doctors. However, I mentioned in my essay that I researched one of the doctors, Dr. Lee Erin Keneally, to see if she was actually a medical doctor. And according to her Facebook, she did actually get her MD. However, according to her website, after earning her MD, she, quote, realized that conventional medicine had very limited returns and began studying alternative medicine. But a lot of them were kind of people who have written books on this subject or were self-proclaimed experts in this subject, and they all said that the true way to cure cancer is through lifestyle changes. You can see some of the examples that they've talked about, and they say that cancer is caused by factors in one's environment, such as toxins in their household or food, as well as what they refer to as emotional toxins, like general stress. And it says that these lifestyle changes are a quick and easy way to slow or reverse the process of cancer. And it also says that these changes, though simple, are not adopted because it is a very difficult and drastic change. And they repeatedly drive home the point that you are responsible for your own health. I also explored the comments on the documentary because they were really interesting. The video has 174 comments, and most of them support this documentary. There were some comments calling it a wake-up call for everyone. Another comment, as you can see, said that it was actually a law that cancer doctors can receive payments for each patient using chemo. I interpreted this as kind of a misunderstanding of the for-profit medical system, which does exist. So this comment is kind of based in fact, maybe just a lack of understanding about the nuances of the for-profit medical system. And both of these channels I saw had very, very long playlists of conspiracy videos. And I also saw that a lot of people who commented either had cancer or knew someone who did. I also explored other articles on FAME's website about cancer. I saw that a lot of them had very vague language. For example, one article called "The Apoptotic and Anti-Cancer Effects of Cinnamon" says that cinnamon may inhibit cancer cell growth. And I noted in my field journal that this vague language maybe to avoid lawsuits in case these treatments did not work. I also saw that a lot of the authors of these articles, when you research them, often the first thing that comes up is some sort of promotion for a book that they wrote or nutritional supplements that they are promoting. That Cinnamon article was attributed to a group called Green Med Info, and the first thing I found on their website was an advertisement for a book. So this kind of implies what motivations these people or these groups may have. And now we go to my research question, which is why people may turn to alternative medicine despite its proven ineffectiveness. I found one of the reasons was distrust in the medical system. This could be especially common among people of color because, as we've discovered, the medical system has a long history of discrimination against people of color, and a study by Hughes Halbert et al. Actually shows that people of color diagnosed with prostate cancers had increased distrust in the medical system. I also found in a book chapter by Linda Gorman that cancer patients often have deep-seated fears of pain, suffering, and death. Cancer has a very negative connotation, and this can drive cancer patients to search for normalcy, control over their own body, and overall optimism. Fame recognizes this need for control and constructs this narrative of, yes, you can reverse your own cancer if you adopt these lifestyle changes and buy these products. Overall, it's just an advertising agency that recognizes the psychological vulnerability of cancer patients. And it actually makes a good point on the need for both physical and psychological treatment after a cancer diagnosis. I found this book, Cancer Care for the Whole Patient, Meeting Psychosocial Health Needs, that kind of summarizes the need for physical and psychological treatment, possibly so that cancer patients do not fall victim for these tactics and adopt faulty treatments. And here are some of my references. Thank you for coming to my presentation, even though it was virtual. I appreciate your time.